In the emergency department, patient experience is very critical. It not only gives the patients a sense of understanding that their needs are being met, but it gives us, the staff, a feeling that they're accomplishing something. We all do a profession because we want to make the world a better place. So in the emergency department, these folks are the front line of a health system.
So when you're looking at your ED and trying to understand, are you really meeting your brand standard, or you're trying to improve a process or a flow or an patient experience, a good way to start on how you analyze that is what we call the 3 Ps, which are people, process, and place. And they really cover the gamut of different things that you can look at to understand your health system. So people, for instance, is probably the easiest one to understand, which is your demographics. What is the area that you service make up?
Process for any institution helps kind of establish a framework for which we're going to work within, and giving your staff kind of that understanding of this is how we're going to deliver care is not only beneficial to them because it starts to organize how they're going to deliver care and gives them that rhythm, but it gives the communication strategy to patients. So from a staff to patient and that back and forth, it helps them to understand, okay, here's what I'm going to expect, right? When I walk in, every time I go to that ED, I'm going to see a clinical person.
And probably the most existential one, of course, is the place. How do patients experience that area? How does staff experience that area? And this is a really important part for me. My family members are all in the medical industry. I have 2 surgeons and I have a nurse who works 12-hour shifts.
So when you address the staff, you want to really focus on making sure that they're not getting burnt out, because they are the ones who have to deliver the care to a patient. So if you want to improve your patient satisfaction, you have to improve your staff satisfaction. How do you try to make sure that things like noise, sound, the constant beeping of just different monitors, are all in tune with the space and they're not, driving the staff bonkers?
When designing the experience in your emergency department, it's really important to understand how it supports the culture you have or the culture you really want to promote in your health system. It's not always about speed, it's about the quality. Have I been listened to? And so understanding that and how a patient might see the space is critically important. And on the inverse, again, we can't forget about staff, the people working that space. How do they feel? Imagine coming to work, you may have had sick kid at home or something like that, and then you come in and see that waiting room full of people. It's not going to start you on the right foot either. So how do we work to improve it both for the patient and the staff when we're designing the space?
Trying to solve every emergency department as a one-size-fits-all problem, never good. Every scenario has its nuances. And then really paying attention to those folks that you are empowering to be the front line of defense. Right, these people have a very tough job, and so how are you helping them understand the culture that you're trying to put out there, and so that patients know that this is what I'm going to expect from this health system every single time, and they come and deliver.